Now, when, for example, 100 ml of blood is passing from alveoli, the partial pressure in entry side, this is the entry side. Oh, trust me, this is the entry point of the blood coming from right heart. The partial pressure is 40 mm of Hg. The partial pressure here is 100 mm of Hg. This is the partial pressure difference, and due to this difference, this oxygen is diffuses until this partial pressure become same, right? And the saturation is 75% here, but when this partial pressure become 100 mm of Hg, this 100 ml of blood is passing from here. Due to this partial pressure difference, which is 100 mm of Hg here in alveoli and 40 mm of Hg here in blood coming from right heart, due to this diffusion occurs, right, until this partial pressure become 100 mm of Hg, and the Hb saturation is also 100% because 75% is also saturated already, and the 25% is remaining, mean that this hemoglobin transferring are coming here for only attaching one oxygen molecule, right? Now, due to this bronchial circulation, which is the deoxygenated circulation, due to this partial pressure dropped to 95 mm of Hg, and according to this graph, for example, if I remove this linear graph, which is normal, which is for normal, and hemoglobin have a very big attitude, so hemoglobin is not following the rules, and when the partial pressure is decreasing, the saturation of hemoglobin is not decreasing that much, right? So when this partial pressure become 95 mm of Hg, the saturation is only dropped by 3%, right? Now, this is the entry point of the blood into heart, but I have I have told you that you will remember three parameters. These are only two. One is the content of oxygen in blood. How many oxygen is present in 100 ml of blood? So according to a research, 1 gram of hemoglobin can attach 1.34 ml of oxygen. Trust me, this is in Guyton book, right? If now, according to another research, we are taking 100 ml of blood. Remember, 100 ml of blood, and 100 ml of blood there is 15 grams of hemoglobin, right? And 100 ml of blood, 100 ml of blood, we have 15 grams of hemoglobin. Now we can calculate this very easily, right? Because as we know that 1 gram of Hb have 1.34 ml of oxygen, so 15 grams of Hb, which is present in 100 ml of blood, will bind to 1.34 into 15 at 20.1 ml of oxygen. As this is the right value, as this is force your common sense. Why? Remember one thing, that oxygen is not directly jumping from high hemoglobin to tissues. For example, if there is hemoglobin, this is hemoglobin, and this tissue needs oxygen, this oxygen cannot jump directly here, because plasma also have dissolved oxygen. Oxygen is very undissolved gas. We porosely dissolve it in fluids, right? So 100 ml of blood at 1 mm of Hg, at partial pressure of 1 mm of Hg, 100 ml of blood have 0.003 ml of oxygen in dissolved form. Dissolved form. What's mean by dissolved form? For example, this is the capillary, blood capillary, and this green are RBCs. Can RBCs are green? No. Right. So these are RBCs. Right. The hemoglobin oxygen is present in blood in two forms. First, remember this, blood have oxygen in two forms. One is dissolved form and one is hemoglobin bound. Hemoglobin bound we have calculated, that is 20.1 ml, right? But here, if this partial pressure is increased by 100 mm of Hg, because after it gets saturated, the partial pressure is 100 mm of Hg. So when this 100 ml of blood having 100 mm of Hg partial pressure, 0.003 into 100, right, mean that 100 ml of blood have only 0.3 ml of dissolved oxygen. 0.3 ml of dissolved oxygen. Now, if we add these two things, in dissolved form it have 0.3 ml of oxygen, and bound form it have 20.1 ml of oxygen, mean that 100 ml of blood have 20.4 ml of oxygen, right? It have 20.4 ml of oxygen, right? But this is on partial pressure of 100 mm of Hg, right? When this partial pressure is decreased by 95, let me clear you. I have to give you a very clear concept, right? For example, I am getting the graph, another graph here with this graph, which is for the content or amount of oxygen, right? At 100 mm of Hg, I have 20.4 ml of oxygen, right? But when we drop this 100 into 95, for example, now at joining this point and here at joining this point, mean a very partial or a very low decrease in oxygen amount. So it will become, for example, it become 20 ml, right? So shortly this is 19.8, clearly it is 19.8 or 19.5, but here we are taking 20 ml for easiness, right? Here the amount in 100 ml of blood, the amount of or content of oxygen is 20 ml. Now the three parameters are fold, right? We will see these three parameters in every point. This is the entry point, right? We will discuss this 5 or 15 ml after this, right? Because now we are not knowing that how much oxygen will get diffused into body tissues, right? This 100 ml of blood, for example, this is 100 ml of blood having partial pressure of 95 mm of Hg. This is partial pressure of oxygen, right? This is the saturation, right? Remember that in pulmonary patient or circulatory patient or in every patient which is in critical condition, we are calculating regularly this saturation. When it is above 90%, we are saying that this patient is stable, right? But if this saturation is decreasing from 90, we are getting worried, right? Now I hope you will understand that why doctors use the oximeters for oxygen saturations, right? Because it calculates the amount of oxygen in your blood, which is very, very necessary for your body, right? This is that saturation, right? And this is the content of oxygen in blood, right? We will add one another thing, the dissolved oxygen, dissolved oxygen, which is 0.3 ml, 0.3 ml, right? Now this blood, this 100 ml of blood goes into left atrium, and from left atrium it goes into left ventricle. From left ventricle, when the left ventricle contracts, right, it will distribute this blood into whole body. We are taking only one cell which is from muscle, right, because you all know about the anatomy and physiology of muscles, right? For example, you are in resting positions, I am in resting positions, right? Now we will see this in resting position, because this story is a little bit different in during exercise or severe exercise or spontaneous exercise, right? Now this oxygenated blood through aorta, can I remove this naughty hemoglobin? This is very shaitan, like Rakibun Nisa, and his teacher, her teacher also, right? This teacher and students are sitting together. She is teaching the naughtiness to right, this innocent, and becoming her shaitan, right? So this just for refreshment, okay? Now this oxygenated blood is passing from here. Remember that these are capillaries, these are very very tiny blood vessels having only one membrane of squamous epithelium, right? And this is the, for example, this is the blood coming here. We need here the extracellular matrix also, right? Now this is the entry point to heart of blood, right? Where the partial pressure is 95 mm of Hg, the saturation is 97%, the amount of oxygen is 20 ml, and dissolved oxygen is 0.3 ml. This is the entry point, and this is the exit point of the blood, which is same as entry, because there is no oxygen consuming here. The oxygen consumed by heart, but that capillaries are called coronary arteries, and they are coming from aorta, right? And they are counting as a body tissue, right? No oxygen is consuming from this blood, because during contraction, when this ventricle contract, this blood will distribute into, now here the story will change. This is the entry point of blood into body tissues. At the entry point, the partial pressure, now you will tell me, right? If you tell this, I will decide that you are understanding, right? What is the partial pressure here? Partial pressure, tell they are 95%, 95 mm of Hg, because this is the same blood coming from here. What is the Hb saturation? 97%, right? What is the dissolved oxygen? 0.3 ml, good. And what is the content of 20 ml? 20 simply, right? This blood is entering into body tissues. Now here is the partial pressure is 95%. In resting condition, the partial pressure in muscle cell is 40 mm of H. Remember or write this in your notebooks. In resting position, the partial pressure of oxygen in muscle cells or body tissues is 40 mm of Hg. So now here the partial pressure of oxygen is 40 mm of Hg. But remember, here is mitochondria. Lot of mitochondria is present in this cytoplasm. A lot of processes occurs in this, and this oxygen is regularly decreasing. Right? This is now poor because he is needy of oxygen. Right? Now hemoglobin is passing from here, and look at the window of the car to this cell that he is very poor and he needs oxygen. I have a lot of oxygen, I can donate. Right? So here is the part again, this is the partial pressure difference. Right? The partial pressure difference. Now I will take that hemoglobin again here. For example, this is RBC. This green is RBC, right? This is RBC, right? And this blue content or this black content, this is the plasma, right? Blood plasma calculating as extracellular fluids, right? Here we have the beautiful hemoglobin having 100% of or 97% of saturation. Mean one oxygen is binding here, one is here, one is here, and one is here, right? And 0.3% oxygen is already present in plasma and dissolved form. This is very low amount, 0.3, but this is very important because this partial pressure is maintained by the 0.3% of oxygen. Right? Now here this is the extracellular space. Of course this is the extracellular interstitial fluids. Right? First of all, this oxygen cannot jump from here to this cell. Right? It cannot jump from here to this cell directly. First of all, this dissolved oxygen will goes into the tissues. Understanding?
Yes, sir.
Right? Here oxygen will diffused due to partial pressure difference. Right? For example, this is the graph. This is the graph. Until this partial pressure is decreased by this is 95%, 95 mm of Hg, here 40, it will become same, and oxygen is coming from blood to tissues. So this partial pressure will drop by 40 mm of Hg. Now it become same and no further oxygen will diffuse into body tissues. Right? This is clear. Now here is 20 ml of oxygen. Do you know this? Right? If we divide this 20 into 4 parts, we will get 5 plus 5 plus 5 plus 5. Right? For example, this is 20 oxygen and we are splitting 5 plus 5 plus 5 plus 5. Now I mean that 5 ml of oxygen is binding here, 5 ml of oxygen is binding here, 5 ml of oxygen is here, and 5 ml of oxygen is here. This is whole 20 ml. Now we have already discussed that this blood is 75% saturated. Right? Mean that only 5% of oxygen will goes to the plasma, and from plasma into extracellular fluids, interstitial fluids, and from here into body tissues. Mean that out of 20 ml, only 5 ml is getting by body tissues. Understand? This point is clear. Now this saturation is decreased by, for example, this is 25%. Of course this is 25%, this is 25, and this is 25, this is 25. Now if we subtract this 25 from 100, it will become 75. So the Hb saturation here is 75%. Right? And this is the hemoglobin having 3 already attached oxygens. Only one oxygen is removed from hemoglobin. Right now, if we calculate this 5 ml, for this is for 100 ml of blood. Remember, this is for 100 ml of blood, and one cardiac cycle, during one cardiac output, 5000 ml of blood is ejecting from left ventricles, and during 1 minute. For example, come here, if 100 of ml of blood per minute giving 5 ml of oxygen into body tissues, and one cardiac output is 5000 ml of blood per minute, it will give how many oxygen to body tissues, right? We will cross multiply this. For example, 100x into 5 into 25,000, right? When we divide this by 100 and this also by 100, x is equal to 250 ml. Now it's clear that during 1 minute 250 ml of oxygen is getting by body tissues every minute. This driver is also naughty like hemoglobin. Right? During each minute, all the body tissues collectively gets 250 ml of oxygen. This is clear. During 5 liters blood circulating or ejecting from left ventricle during one cardiac cycle, during 1 minute, it gives 250 ml of oxygen to body tissues, right? So here, come here, for example, this partial pressure is dropped to 40 mm of Hg. This is 40 mm of Hg. At 40 mm of Hg, the saturation is 75%, right? So the saturation here is 75%. The partial pressure is 40 mm. What is the amount? What is the content of oxygen? This is very, 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 very easy. Out of 20, 5 ml is dissolved into tissues. How many is remaining? 15 ml. So 15 ml of oxygen. At entry point, the partial pressure was 95. The saturation was 97. Dissolved oxygen was 0.3 ml and the content was 20 ml. Here, during outing point, the partial pressure is 40 mm of Hg. The saturation is 75%. The content is 15 ml, right? And now this blood carbon dioxide, we will discuss carbon dioxide in another lecture, right? We are talking only about, if I am discussing the carbon dioxide collectively here, you will get confused, right? Because the partial pressures are very much same, and if we miss that lecture, only remember that here the partial pressure of carbon dioxide is 40 mm of Hg, which is same as to oxygen, right? And the partial pressure of carbon dioxide here is 45 mm of Hg. So this is also the, this is 45 mm of Hg and this is 40 mm of Hg, right? This partial pressure difference gets the carbon dioxide diffused into blood. You will remember this, right? Here the partial pressure of carbon dioxide is 40 mm of Hg and here is 45 mm of Hg. Due to this 5 mm of Hg difference, this carbon dioxide will get diffused into the blood and will bind to this one side. And of course, the books are saying that one hemoglobin can bind to 4 oxygen and it will carry only 1 carbon dioxide in the form of bicarbonate ions, right? In the form of bicarbonate ions. We will discuss this in gaseous exchange, right? But here this blood become deoxygenated. It become deoxygenated and well goes into this is vein, which is called vena cava, inferior or superior. The superior vena cava is coming deoxygenated blood, taking deoxygenated blood from upper parts, and this inferior is from lower parts. Now it will joins the right atrium, and this is the right ventricle. Right, the blood entering into this right atrium is having 40 mm of Hg partial pressure, 75% saturated, and the content is 15 ml. Right, from here it will goes again. Now only the content is remaining here, and the content here is 15 ml. Right, and now this cycle will repeat it, because the partial pressure difference of carbon dioxide will again diffuse the carbon dioxide into here, because here when the partial pressure is of carbon dioxide is 45 here and carbon dioxide is going here, the partial pressure of carbon dioxide will become 45 mm of Hg here also. It will become same and no further diffusion will take place. Here the partial pressure of carbon dioxide is 45 mm of Hg. This is 40 mm of Hg, this is 45, and the partial pressure here is 0. Carbon dioxide partial pressure in alveoli are 0. It is a great partial pressure difference, and this carbon dioxide will rush into the alveoli, and when we exhale, the carbon dioxide will get rid of this alveoli. Right, this is just the look of the gaseous exchange which occur during one respiration. Right, any confusion, any question? Are you understanding? I mean, you are sleeping, and the sleepy persons cannot get confused. Right, this is very, very interesting if you are understanding this. Right, okay, thank you. We will discuss the processes tomorrow. The first process is respiration. How respiration take place, what is the breathing process, what is the mechanism of breathing. Right, we will discuss this in detail further.